want to thank the participations of the students of UMass Dartmouth, the nursing school, and advanced students for their participation in the Age-Friendly Community program at Dartmouth. We're at the Council on Aging, and we'd like to thank you for tuning in. Today, the Town of Dartmouth has taken its first steps in joining the Age-Friendly Community Initiative. We've been meeting as a group of different agencies and nonprofits in town and working with UMass Dartmouth and the students to provide information for the town. The students have been out collecting information. Some of you have seen the AARP survey that's been delivered to your door in various methods and means, and you filled it out and sent it back in, and the students are working on the results. So we're really excited. Through this process, we're focused on planning some developments and to take some opportunities to make the town a more attractive, safe, and vital community for everyone, especially for those over 55, which we would like to say is going to be a growing population as the baby boomers age and we all get older, we hope. And looking at resources in the town, where the town is spending its money for this population, which is increasingly larger and larger part of the town. So we have something to look forward to. So with that, I'd like to introduce the students to come forward and present a little bit about their information gathering.
Good afternoon. My name is Jessica Mitchell. I'm a clinical instructor with UMass Dartmouth, and I've been working with the students to get the survey going, and we're now in the planning phases and analyzing data and developing a plan to present to the town. So I'll first introduce Tracy Nunn.
Good afternoon. My name is Tracy Nunn, and I'm a student at the Accelerated Bachelor of Science Nursing program at UMass Dartmouth. Thank you for welcoming us into your community. Basically, right now, like all good projects, you need to start by knowing where you are beginning, and the first thing you do is to gather that data. The wonderful news that we received from our surveys is that the majority of people who are in the 55-plus age group in Dartmouth consider themselves either to be in very good health or excellent health in comparison to their peers, which of course is a wonderful thing to say about Dartmouth. They believe that the major factors impacting the quality of their life with regards to their health care are the accessibility of home health care, with the emphasis on the training of the employees of those agencies, their fluency in languages, and the affordability. They're also very concerned that we continue to have well-maintained hospitals and healthcare facilities, helpful clinics, and they want to look at aging in place and the factors that will help them do that gracefully and help them do that as you move through the different stages of need and dependency that most of us are going to go through at one time or another. We also looked at the social, nutrition, and exercise components of life as a person over 55 in Dartmouth. One of the things that was very clear to us is that most people have a very good understanding of the importance of social participation, physical activity, and nutrition. We also found that one of the things that people in Dartmouth are really looking forward to is having interaction with different age groups of people. We are looking at ways in which perhaps we can help that happen or facilitate those kind of interactions. And one of the things that was kind of striking is they found that only 10% of the people reported that they felt those opportunities, in particular the opportunities to interact with different age groups, were readily available. In our investigations, we have found that there are actually an awful lot of opportunities, and one of our main focuses or one of our main suggestions is going to be in creating ease of outreach, in creating situations where people can access that information, access those activities and facilities in the community, and perhaps creating partnerships with agencies that focus on other groups, for example, the public school system. Another thing that we would really like to do is to go ahead and work with our School of Nursing, because the ABSN program in particular has a wide degree of expertise and knowledge and training, and create helpful documents and flyers that perhaps you can you can share with the people in your life that maybe you want to see this, take home for yourself, so that we can start to create networks that will support graceful aging in place. So we look forward to working with you. Thank you.
Thank you. And our next student is Barbara Souza.
Good afternoon, and thank you for allowing us to come and look at this data and make our recommendations. I am representing the housing population, and when we looked at the data from the survey, over 90% of the aging population in Dartmouth owned their own home, and would like to stay there as they age. So our focus is to make recommendations, create resources to allow aging population to stay there. Some examples are costs associated with remaining in the home, some home fit guides, some low or no cost improvements that are posted on the AARP website, reliable contractors, some PCA programs, and adult foster and or daycare to allow aging populations to remain in their homes. Thank you.
Okay. And then there's one other topic that we'll be looking at, which will be transportation, and how to get people to and from different activities, whether it be grocery shopping or doctor's appointments or just social events going on in the town. And their students are looking at different grants that are possible and other things. So there's a lot of excitement going on and a lot to look forward to. So thank you for having us.
Do we have questions that we would like to ask you guys? First of all, I would like to thank you for your participation with the Dartmouth town. Sometimes UMass Dartmouth can be a little bit of a isolated island away from the community, and it's exciting to see young people in the community doing research that actually matters and has definite results that we're going to see. We thank you so much for your participation. We thank you for your involvement and your just energy in doing this. It's a wonderful thing to see. We're excited to see that we've had over 400 surveys return. There's a good amount of data that's available for people to look through. And I wondered if you could tell a few stories about your interactions, some positive stories of what you see as the needs for people in Dartmouth, maybe a few stories of interactions with your clients in the Dartmouth pool that you've talked with. Does anyone have any stories that you want to bring forward?
It's, nothing more than anecdotally, but one of the things that I was really fascinated as I have been here at DCA, in fact, just this morning, and also talking on the phone with people, which I realize is a rather hello, here I am on the phone, will you talk to me kind of situation. But people are very open and very generous, and one thing that I thought was amazing is how much they want to stay connected. The ability, I'm the only one with a driver's license in my group, so I kind of help other people out. Transportation is an issue. This is what we want to see in our community. And I think anytime you've got the ability to localize what you need, it gives you the power to ask for it. And that to me, that the level of education in the older population, the level of engagement, which is just phenomenal, I think is it has just blown me away. I'm not from here. I'm from the Midwest, so this has been quite an education in how things work on the East Coast. But I do think that given the opportunity, and that's one thing that I know UMass Dartmouth is really looking forward to being able to do, given the opportunity, I think that you will have enthusiastic participation, especially once we figure out what is here, what can we access, what can we help people access as far as taking care of themselves, taking care of their homes, and interacting with one another and interacting on a deeper level with their communities. I think we'll be able to help Dartmouth put those pieces in a nice cohesive puzzle so that we can create access to education. We can create access to transportation. We can create access to the hospitals. We can create access to UMass Dartmouth. And as a single mom, I am really excited to hear about some of my colleagues who are focusing on the social nutrition part of it, talking about accessing the level of expertise to foster that intergenerational contact. I think the benefits of that are not simply on the older side of the spectrum. The benefits of that are on the other side of the spectrum as well. And I know we have a culture that's very disenfranchised and very spread out, and the more we can do to create intergenerational communication, the more holistic we're going to be as a culture. So I think that's kind of the cool thing. That's what I'm hearing when I talk to people. I'm also hearing, get off my phone when it's time for lunch, and that's okay too. So, but anyway, so.
I was wondering, when you've collected this data, what's the next step? I know you have some presentations that are coming up. There'll be some presentations before the select board. The town has opportunity to see the results of this. It's not going to be a closed study. It's going to be presented to the town. We're going to have opportunities to see what you guys have done and the recommendations that you've made. So that's very exciting as well. But perhaps, Jessica, could you talk a little bit about the next few steps and how the town is going to find out about these results?
Yes, so the biggest plan for the students will actually be at their scholarship day, which will be at UMass Dartmouth in the library on April 24th, which is a Tuesday. That event starts about 3:30 with posters and then leads into presentations around 4:30. Also, we will, myself along with Amy DePietro from the Council on Aging, will be going and talking with the select board at some point in early May to discuss some of the findings and sort of what the plan is for the future. And we're hoping to keep this project going in upcoming semesters so that whatever development is made here gets some growth later on.
Have some things available at town meeting, if I'm not mistaken.
I believe this still in the works of a potential booth or some information packets to go out so that the residents can see exactly what is going on.
So one of the questions is how we can compare the data that we gathered to actual data, statewide data, and then also maybe even across the United States data. And one thing it's important to consider is we were able to survey close to 500 residents in the area. I believe our total population is about 8,000. Is that correct? About 10,000. So we were able to reach a very small percentage. About 500 people is still a good amount. What the survey looks at is an individual's perception of how their health is. So what we are able to report on is what they see as reality. So we found in that particular topic area that people felt that they were healthy or very healthy. So that's just what they compare to whatever they have to compare it to. So definitely when we report in our each area that we're looking into, when we report that, we are comparing to statewide data, United States data, and definitely the goal is to compare what the expected numbers would be versus what we have reported. And then with that, we take that with a grain of salt. If many people think they're very healthy, we do know that diabetes, there's a huge incidence of diabetes and other chronic health diseases in the elderly. So we have to take all of that into consideration. So,
You know, Erica did a fantastic job talking about your perception of your health versus perhaps some actual real life health issues. And of course, that's something that every single one of us is going to deal with. I can think I'm very, very healthy, and that's wonderful. That gives me agency, that gives me the ability to think I have power over this. And one of the things that we saw is very important and was identified as being very important was to provide access to well-staffed, easily accessible healthcare clinics. And certainly that's one of the main avenues that you can have someone age gracefully in place. You can have diabetes that is well managed. You can have other health issues that are well managed and still maintain an excellent quality of life and still maintain the perception and quite frankly, the reality that you are a very healthy person. And I think when you see those two things dovetailing, when you see I have this perception that I am very, especially in comparison to my peers, I am very healthy. That can exist at the same time you acknowledge I also have these health issues, and part of maintaining my excellent health is maintaining access to knowledge and to care. And that's one thing that I know our group is going to be talking about is how do we make sure that we keep these people having access to that care so we can maintain that perception that this is a very healthy, good place to be an aging person. So.